Okay, good morning, everyone. Welcome to Coalition for People's Right to Health's weekly webinar entitled "Raise the Bar." And specifically for today, we are going to discuss how Taiwan is beating COVID-19 for its people. So, in our previous webinars, we discussed how the situation is in the Philippines. No? So we've been showing kamusta na ba talaga ang COVID-19 sa ating bansa, no? So may kita natin yesterday, no, kahapon, June 29, 2020, we have had a total of 36,438 cases, no? So the prediction was that at the end of June, aabot daw tayo ng 40,000 cases. But today, the last day of June, we shall see if we will inch towards that 40,000 prediction. But apparently, there are others that are celebrating that we did not reach the projection. But still, the information and the data shows that we have had over 44,000 positive cases, but not necessarily the confirmed that is only 36,000. But still, we have yet to see the effects, no, in the long term, how bad COVID-19 is actually going to hit the Philippines, because we see that there are areas in the Philippines where there are increasing number of cases, for example, in Cebu and in Western Visayas, as well as in Northern Mindanao. These are some of the areas where the positivity rate, no, or the number of tests are going up. And this is something that we need to really concern ourselves with, especially coming into July, coming into the next few months where we have to actually raise the bar. No? We have to raise our standards with how our government and with how the pandemic response is being done in our country. So we still have a long way to go, especially in doing testing and doing proper epidemic controls, no, that are specifically medical responses and specifically oriented towards mitigating COVID-19 rather than treating it as another disaster, as something that can be solved with solutions that are non-medical. No? So we have a long way to go and more work to be done in trying to mitigate COVID-19 in our country. So with that, we move to our topic today, which is about Taiwan. No? So it's our neighbor to the north. No? So it's a nation that has faced COVID-19 earlier or around the same time as us, around January or February, where we've seen COVID-19 hit initially Wuhan in China before spreading towards its neighbors, including the Philippines as well as Taiwan. So in Taiwan, the first cases started as early as January, especially from tourists coming from the mainland as well as those working from China and in Taiwan. Similar to our situation in the Philippines. Our first three cases in the Philippines were actually tourists from mainland China, and in Taiwan, a lot of the initial cases were similar. And however, what is the main difference? Again, the Philippines has 36,000 cases. Meanwhile, Taiwan only has 447. So it's a span of 5 months, and they've only had 447 cases. So how did they manage to do that? How did they manage to have 7 deaths and only 5 remaining active cases? In the Philippines, we have thousands of active cases. In the Philippines, we have so much more cases. No? But one thing that is distinct from what Taiwan did is that in the Philippines, we have a big clamor for mass testing. In Taiwan, they have only tested 80,000 individuals, and yet they have only 447 cases. So for today, that is what we are trying to find out. How is it that Taiwan has defeated COVID-19 for its people? So that is something that we shall discuss for today. So for everyone watching in the Philippines, so thank you for joining us again today. makinig po tayo, paano po ba natalo ng Taiwan ang COVID-19 para sa kanyang mga mamamayan. And for those watching in Taiwan, I think some of our speakers, we have two speakers today that are from Taiwan, and as well as their friends who are watching. So Juan E, and hopefully everyone can listen and to our um, webinar for today, which is about entitled Zero, how Taiwan is beating COVID-19 for its people, or Ling, Taiwan, Taipei le 新冠肺炎为人民. So we should pay attention to our speakers and find out how exactly Taiwan has defeated COVID-19 and how we can possibly learn from that and apply the lessons to our country and to our society, so we can improve our standard of health and our standard of living, especially in upholding the people's right to health. So to introduce our speakers, we move now uh, to one of to our colleagues who will introduce our speakers. So we have Dr. Magdalena Barcelon. She is the chair of the Community Practitioners and Advocates Association, or COMPAS, and the chairman of the board of the Council for Health and Development. So she is a community physician, graduated from the UP College of Medicine, class 1977. So good morning, Dr. Rayain, and please introduce our speakers for today. So after we introduce our speakers, we will go to their presentations, and then we will have questions for our speakers.
Okay, isang malugod na pagbati po mula sa Community Medicine Practitioners and Advocates Association. So a warm welcome to our guest speakers for today, our colleagues from Taiwan. One of them is my classmate, and we're so proud of her achievements also in Taiwan. For the first speaker, we have Dr. Michelle Hu. She is an infectious disease specialist, specialist in pediatric infectious diseases, and she had her training at the National University of Taiwan. She is presently a consultant and attending physician at the Cathay General Hospital and at the New Taipei City Hospital. So her topic would be the COVID response, COVID-19 in Taiwan is the title of her presentation. So we are very glad and very grateful to have her with us this morning. So thank you, and let's welcome Dr. Michelle Hu from the New Taipei City Hospital and Cathay General Hospital. Dr. Michelle Hu. So while we're waiting, we're very glad to have this opportunity to have with us our colleagues from Taiwan to explain to us what happened during this past 5 months, 6 months already in their country, and what measures they were able to come up with to be able to control and actually beat the pandemic that is currently posing difficulties to many parts of the world and resulting in a crisis, not only in the medical and health field, but also in the social and economic situation. So
we have a problem in showing the slides.
Okay. So we can now listen to Dr. Hu, and maybe we can fix it along the way, the slide presentation. Is that okay?
Okay. 那我就开始了。
Good morning, everyone. First of all, I would like to thank Dr. Ko for inviting me to give this talk. Today, I'm going to share some experiences of COVID-19 in Taiwan. Here is today's outline, and I think these are the key points for fighting against COVID-19 in Taiwan. First, we have tighter border control to prevent disease outbreak. For the people who are at risk of infection, we force them home quarantine or self-management for 14 days according to the level of risk. We also conduct case investigation and contact tracing when every confirmed case appears. This helps us to find the possible infection source and stop viral transmission as much as possible. People in Taiwan also follow the Centers of Disease Control's regulation to keep social distancing and wearing the face mask to avoid disease spread. The last but not the least, our government employ multiple media channels to announce information timely to keep the public informed. Therefore, people can be familiar with the information about the disease and know how to prevent infection appropriately. In the beginning, I'm going to talk about the border control policy in Taiwan. Our Centers of Disease Control had detected the outbreak news of COVID-19 in Wuhan and initiated onboard inspection for direct flights from Wuhan on December 31st, 2019. Any passengers presenting with fever or respiratory symptoms at the entry fever screening sites of international ports would be referred to designated hospitals for evaluation. Our CDC later listed COVID-19 as notifiable disease named severe pneumonia with normal pathogen on January 15 and activated the Central Epidemic Command Center, CECC, on January 20. In Taiwan, step by step, expanded travel restrictions starting from Wuhan and later extended to Hubei, Guangdong, Zhejiang, and finally the whole China, including Hong Kong and Macau. Due to worsening local outbreaks, the travelers returned from South Korea and Italy also need home quarantine since February 24th and 27th, respectively. In summary, our government adjusted the level of travel notice according to the situation of international outbreak. Finally, we banned all foreign nationals from entering the country since March 19, 2020. And Level 3 travel notice for all countries was issued on March 21st. There are guaranteeing personnel conduct fever screening and health assessment at the airport. Our countrymen came back from Level 3 countries need mandatory home quarantine for 14 days. If any fever or any suspicious symptoms detected at the airport, people will receive COVID-19 testing. The second part is about people who are at risk of infection. People who had contact with confirmed cases need home isolation and active monitoring of their own health for 14 days. People who had a broad travel history need home quarantine with active monitoring of their own health for 14 days also. Actually, the measures of home isolation and home quarantine are the same. The difference between these two groups is the responsible authorities. Home isolation belongs to local health authorities, and home quarantine is local civil affairs bureau or bureau chief in charge. Besides, reported cases who have tested negative and met the criteria for being released from isolation, or people reported and tested for COVID-19 under COVID-19 community-based surveillance need self-management for 14 days. Self-management people need to avoid to go to public places. Every time when they're going out, they should always wear a medical mask. Moreover, they also have to take body temperature twice a day. If you develop any clinical symptoms during self-management period, you should seek medical evaluation immediately and avoid public transport when you're going out. Meanwhile, you should stay at home before receiving the COVID-19 testing result. We classify people who are at risk of infection into these three groups. Anyone fulfill the criteria of home isolation, home quarantine, and self-management need to follow the regulations to prevent disease spread to others. Taiwan Centers of Disease Control and local health authorities conduct a thorough epidemiological investigation and contact tracing when every confirmed case appears. The investigation period started at the date of symptom onset and ended at the date of COVID-19 confirmation. The period can be extended to up to 4 days before symptom onset if epidemiologically indicated, which is the same as WHO's recommendation. For a symptomatic patient, the period investigation was based on the date at confirmation and was determined according to epidemiological investigation. If you have close contact with confirmed cases within the investigation period, you need home isolation for 14 days. And COVID-19 examination will be arranged if the close contact has suspicious symptoms or being evaluated as high-risk group. For example, they are roommate, spouse, family, or passengers sit close on the flight, and etc. And the definition of close contact including people living together, face-to-face contact with a confirmed case for more than 15 minutes without personal protection equipment. For medical staff, hospital workers, and other patients in the same setting, close contact was defined by contacting an index case within 2 meters without appropriate personal protection equipment, regardless of the exposure time. Taiwan COVID-19 outbreak investigation team conducted a prospective case accident study from January 15 to March 18. The final file update was April 2nd, and this study was published at JAMA Internal Medicine in May. This study enrolled all the initial 100 confirmed cases in Taiwan and their close contact. Total 2,761 close contacts were identified. All contacts were followed up until 14 days after the last exposure to the index case. 5.5% were household contacts, 2.8% were non-household family contacts, and healthcare contact accounts for 25.3%. And others, including friends, airline crew members, and passengers, and other cordial contacts. This table listed the characteristics of the 2,761 close contacts, and the time from onset to exposure is defined as the elapsed time between the date at symptom onset of index case and the first day at exposure. For example, people from the group less than 0 days had their first contact with the index case before the case and had any symptoms. "22 secondary cases of COVID-19 infection was detected, and there are 4 asymptomatic infections. So the secondary clinical attack rate, according to the study, was 18 of 2,761. That is 0.7%. And this figure shows the exposure window period of all contact. All of the 22 secondary cases had their first exposure before the 6th day of the index case symptom onset. About the non-case contact, only 68% had their first exposure before day 6. The secondary clinical attack rate was higher among those who had initial exposure to the index case was within 5 days of symptom onset than those who were exposed after day 6. We can see that there are total 852 contacts with the index case after the 6 days of symptom onset, and the transmission rate is 0. The 735 contacts whose initial exposure occurred before symptom onset of the index case were also at risk, with a secondary clinical attack rate of 1%. The 95% confidence interval is 0.5 to 2. A subgroup of 299 contacts with exclusive pre-symptomatic exposure were also at risk with the secondary clinical attack rate of 0.7%. The secondary clinical attack rate was 4.6% among 151 household contacts and 5.3% in 76 non-household family contacts. The 95% confidence interval is 2.3 to 9.3 versus 2.1 to 12.8 respectively. About the age of close contact, the attack rate was higher among those aged 14 to 59 years old. The secondary clinical attack rate is 1.1%, and those aged 16 years and older, with the secondary clinical attack rate of 0.9%. More severe clinical condition of the index case also lead to higher secondary clinical attack rate. To summarize the case investigation and contact tracing finding, close contacts to confirmed COVID-19 cases reveal a relatively short infectious period of COVID-19 and a higher transmission risk around the time of symptom onset of the index case, followed by a lower transmission risk at the later stage of disease. The third part is about medical care for confirmed cases. Patients with COVID-19 are routinely hospitalized in Taiwan. Our Centers of Disease Control adjusted the case definition according to constantly updated information about COVID-19. Initially, we focused on people who had fever, acute upper respiratory tract infection, or pneumonia accompanied with a broad travel history. However, the first COVID-19 infected patient without exact infection source in Taiwan was found on February 16. Therefore, our Centers of Disease Control modified the original case definition of suspected COVID-19 to include patients with undiagnosed pneumonia, regardless of the travel history. After China released the whole genome sequence of SARS-CoV-2 on January 10, Taiwan Centers of Disease Control National Reference Laboratory immediately set up the real-time RT-PCR test for the virus. By February 21st, Taiwan had 27 laboratories that could perform up to 2,250 molecular diagnostic tests for SARS-CoV-2 a day. This is current case definition of suspected COVID-19. Clinical presentation criteria include fever or symptoms of acute respiratory tract infection, abnormal sense of smell, abnormal sense of taste, or diarrhea of unknown etiology, or community-acquired pneumonia highly suspected to be COVID-19 by doctor. And the laboratory diagnostic criteria are pathogen specimen isolated and identified from the clinical specimen, or positive molecular biological testing for viral RNA from a clinical specimen. And the specimen used for exam including nasopharyngeal swab, throat swab, expectorated sputum, or lower respiratory tract aspirate. Epidemiological criteria include at least one of the following within 14 days prior to symptom onset. First, history of traveling or living abroad, or contact with symptomatic individuals returning from abroad. Second, history of close contact with symptomatic suspected or confirmed cases, including caring for or interacting with this individual, or direct contact with body fluid or respiratory secretions without adequate personal protective equipment. And third, history of cluster related to confirmed cases. If people meet clinical criteria 1 and one or more epidemiological criteria, or clinical criteria 2 and any of epidemiological criteria 1 or 2, or clinical criteria 3, or laboratory diagnosis criteria, reported to our Centers of Disease Control is required. Apart from the suspected case definition, we also have another community surveillance system, which is expected to find the potential cases as far as possible. If people have pneumonia, abnormal sense of smell or taste, fever, or acute respiratory tract infection that didn't fulfill the criteria to report to the CDC, we can check nasopharyngeal swab, throat swab, or sputum for COVID-19 examination for once and report it to the community surveillance system. If the testing result turn out to be positive, the patient will be treated as a confirmed case. It is worth noting that taking the appropriate specimen may improve the accuracy of diagnosis. This is a research published at the New England Journal of Medicine, which showed that the viral load of SARS-CoV-2 is higher from the nasopharyngeal swab than throat swab. This is another study found that bronchoalveolar lavage fluid and sputum are the two specimens accounting for the highest positive test results. And the viral load from the nasal swab is also higher than pharyngeal swab, which is similar with the previous study we just mentioned. Therefore, if patients had pneumonia or sputum production, we encourage they to expectorate sputum for COVID-19 PCR and virus culture examination. Otherwise, nasopharyngeal or throat swab is the alternative choice. Here, I'm going to talk about our medical care policy for confirmed cases. We initiate infection prevention and control at the point of hospital entry. The standard precautions including hand hygiene, use of personal protective equipment to avoid direct contact with the patient's blood, body fluids, secretions, or non-intact skin, safe injection measures, safe medical waste management, and cleaning and disinfection of the environment and equipment. We also give supplemental oxygen therapy immediately to patients with respiratory distress, hypoxemia, or shock, and the target saturation is at least 94%. We also employ conservative fluid management when there is no evidence of shock, and we will give empirical antimicrobials or antivirals to treat all possible bacterial or viral infection for patients with severe manifestation. We also closely monitor signs of clinical deterioration, such as rapidly progressive respiratory failure and sepsis, and respond immediately with supportive care interventions. And we also avoid aerosol treatment such as nebulizer for treating patients with suspected or confirmed COVID-19. The dry powder inhaler or metered dose inhaler can be utilized instead. This is a preliminary report of a double-blind, randomized, and placebo-controlled trial of remdesivir of COVID-19 treatment. Total 1,063 Adults hospitalized with COVID-19 with lower respiratory tract involvement were enrolled during February 21st and April 19th. The participants were randomized 1-to-1 to receive remdesivir therapy for 10 days or just standard care. According to the study result, we can find that remdesivir had a shorter time to recover than placebo, and remdesivir also had lower mortality rate than placebo, but there was no statistical significance. The mortality rate in the remdesivir group is 7.9%, and the mortality rate is 11.9% in the placebo group. In this figure, we can see that the median time to recover in remdesivir group was 11 days versus 15 days in the placebo group. These preliminary findings support the use of remdesivir for people who are hospitalized with COVID-19 and requires supplemental oxygen therapy. This is another study published on the NEJM. Total 397 hospitalized patients who were at least 12 years old with confirmed SARS-CoV-2 infection, oxygen saturation of 94% or less while they are breathing ambient air, and radiologic evidence of pneumonia were enrolled. Patients who were receiving mechanical ventilation, ECMO use, or with signs of multi-organ failure were excluded. In patients with severe COVID-19 not requiring mechanical ventilation, this trial did not show a significant difference between a 5-day course and a 10-day course of remdesivir. With no placebo control, however, the magnitude of the benefit cannot be determined. According to this clinical trial evidence, remdesivir can be considered to use for severe pneumonia or acute respiratory distress syndrome patients in Taiwan. Our Food and Drug Administration approved special import permit of remdesivir for severe COVID-19 cases use in this May. About the criteria of release from isolation. Our previous criteria for release from isolation is clinically recover for at least 24 hours, with 3 consecutive negative tests for SARS-CoV-2 for respiratory tract samples, each at least 24 hours apart. The criteria is quite strict in other countries. Our Central Epidemic Command Center modified the criteria of release from isolation in June. Confirmed cases should fulfill all of these 3 criteria. First, the patient is clinically recovered for at least 3 days. Second, 2 consecutive negative tests for SARS-CoV-2 for respiratory tract samples, each at least 24 hours apart. And we need to take 2 different specimens, including sputum, nasopharyngeal, or throat swab at the same day. The exam results should be both negative. Third, the disease course should be at least 10 days after the symptom onset date. For a symptomatic patient, it should be 10 days after the date of first positive test. And here's the summary of COVID-19 cases in Taiwan. The data were collected until June 5th. Male accounts for 49.7% and female accounts for 40.3%. The median age is 32 years old. Abroad cases accounts for the majority. About 70% of the case had mild disease, 22.6% had pneumonia, and 8.4% had severe pneumonia or ARDS. 5.4% cases need ventilator use, and 1.6% need ECMO support. The overall mortality rate is 1.6%. About the age distribution, Most of the cases were aged 20 to 39 years old who worked or studied in the United States or European countries previously and come back to Taiwan due to global outbreak. There are some other measures that help us to fight against COVID-19. We used to wear a face mask when we are sick, and this hygiene habit is common in our daily life. People in Taiwan were self-motivated to wear a face mask to prevent infection since the beginning of disease outbreak. You can see people wear a face mask not only in the crowded mass rapid transit, but also on the street. I think wearing a face mask is a key point to prevent COVID-19 outbreak in Taiwan. Due to global outbreak of COVID-19, our confirmed cases also increased in number. In order to prevent local transmission, our government further forced people to wear a face mask when you use public transport, including bus, taxi, train, high-speed railway, and mass rapid transit. We restricted the number of people visiting hospitalized friends and regulate people to wear a face mask when they are going to the hospital and other healthcare facilities. Moreover, we also promote to keep a safe social distance of 1.5 meters indoors and 1 meter outdoors. If people can't maintain adequate social distance, wearing the face mask is strongly recommended. There are some research evidence of the benefit of face masks and social distancing. This is a systemic review and meta-analysis published on The Lancet to investigate the optimal distance for avoiding person-to-person virus transmission and to assess the use of face masks and eye protection to prevent transmission of virus. And this study focused on MERS, SARS-CoV, and SARS-CoV-2. Total 172 observational studies across 6 countries and 6 continents and 44 relevant comparative studies in healthcare and non-healthcare settings were enrolled. The face masks mentioned here including face surgical masks and N95 respirators. To focus on face masks versus no face mask, there are 10 adjusted studies and 29 unadjusted studies. The chance of viral infection or transmission without face mask protection was 17.4% and was 3.1% with face mask. There are some inconsistency and result bias. Hence, the authors make a conservative decision that the precise quantitative effect is low certainty. The use of both N95 or similar respirators or face masks by those exposed to infected individuals was associated with a large reduction in risk of infection. The unadjusted risk ratio is 0.34, with the 95% confidence interval of 0.26 to 0.45, and the adjusted odds ratio is 0.15, with the 95% confidence interval of 0.07 to 0.34. And the benefit of face masks has a stronger association in healthcare settings compared with non-healthcare settings. The risk ratio among the healthcare setting is 0.3%, with the 95% confidence interval of 0.22 to 0.41. And the risk threshold among the non-healthcare setting is 0.56, with 95 confidence interval of 0.4 to 0.79. When differential N95 or similar respiratory use, which was more frequent in the healthcare settings than in non-healthcare settings, was adjusted for the possibility that face mask was less effective in non-healthcare settings, the subgroup effect was likely less credible. Overall, medical or surgical face mask is believed to result in a large reduction in viral infection. And N95 respirators might be associated with a larger reduction in risk compared with surgical or similar masks. The association with protection from infection was more pronounced with N95 or similar respirators compared with other masks. The adjusted odds ratio among the N95 or similar masks is 0.04, with the 95% confidence interval of 0.004 to 0.3. And the adjusted odds ratio among the surgical or similar mask group is 0.33. These results concluded that at least 1 meter physical distancing are associated with a large reduction in infection, and wearing a face mask protect people, both healthcare workers and the general public, against infection by these coronavirus, including MERS, SARS-CoV, and SARS-CoV-2. And this support the policy of social distancing and wearing the face mask whether you are sick or healthy, performed in Taiwan. The WHO also changed its advice on face masks in June. They said that in light of evidence involving evidence, the WHO advised the government should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shop, or in other confined or crowded environments. I think that people awareness and education are also important for prevention of the new disease outbreak. Our government employ multiple media channels to announce information to keep the public informed timely. The Center's Epidemic Command Center hosts a daily press conference and publish press release every day for communication with the media and the public. There are also many educational videos to promote self-protection measures displayed on the TV or various channels every day. This helps people to integrate the knowledge into life. About the educational material, they included posters that are pasted in many places and have different language for different groups of people that live in Taiwan. This is my last slide. In summary, timely border control, managing of people who are at risk of infection, medical care, social distancing, wearing a face mask, and people awareness are the way we face with outbreak of COVID-19. And I think all of the components are important to our currently successful experience. Thank you very much for your attention.
谢谢胡医生。Thank you very much, Dr. Michelle. Okay, there. Okay, finally we can see you. we Thank you very much for your presentation. As we can see, as you mentioned, there are a lot of factors that Taiwan was able to do with regards to beating COVID-19. That's not just about the medical treatment as well. No? Although you mentioned about border control and you mentioned the contact tracing. One thing that a lot of us have noticed is that Taiwan hasn't actually tested a lot of individuals, especially outside of Taipei. Is that correct? Sorry.
Test.
The testing. Huh?
Yes, we test many people in Taiwan. But every time, if doctor suspicious the patient had related symptoms or need to be out, we will perform the examination.
In Taiwan, was there ever a need to test people in the community outside those of the hospital?
在医院之外有没有测试？医院之外有没有参与他们做？有没有做 testing？
We also perform the COVID-19 exam at the airport. If you come back abroad or have associated upper respiratory tract or other symptoms, we will test COVID-19 at our airport.
Mhm. This is for everyone who is coming back in, even if you are not a Taiwanese national.
Yes.
Mhm. How in the past? How many days have there been without cases in Taiwan, or has there been a new case in Taiwan in the past few days?
几天没有了，在2个月几天没有 COVID-19 了，几天60几天。
I can't remember exact number,
Okay.
but
Yes.
maybe 1 week, 5 to 7 days.
Okay. We have a question here from one of our viewers. One is asking, um, was there need to have a new law in Taiwan in able to respond to COVID-19? So, are there any penalties like imprisonment or fines if you do not comply with the um, if if there are any violations? For example, if you don't wear a face mask, or you don't notify any hospitals if you have symptoms.
告诉他我们
Dr. Cole will talking about
Ah,
this
okay.
issue.
Yes. Okay. All right. One last thing. With regards to the asymptomatic patients, you mentioned earlier that you do test the asymptomatic patients. Are there a lot of asymptomatic patients in Taiwan? And in your experience, especially among the children, uh, are there a lot of asymptomatic patients
Uh, the
in
case of
Taiwan?
asymptomatic is few that usually find
Okay.
out due to their families have
Mhm.
confirmed of COVID-19 and due to living together or close face-to-face close contact. So we were tested also and find that they are confirmed to have COVID-19, but they are symptomatic. The case are
Yeah.
few.
Mhm. When these patients are asymptomatic, they are quarantined.
Yes,
Where are they quarantined?
and every time we have case confirmed of COVID-19 infection, they need to be hospitalized in Taiwan,
Mhm. Mhm.
quarantined in the hospital until the
Oh, okay.
COVID-19 PCR turn negative.
Okay, even if they are asymptomatic.
Yes.
Oh, okay. Yeah, so are the hospitals overloaded? Are they full, or was there a time that the hospitals were very full?
Um, Currently, our hospital facility is still enough to handling the patient. So
Mhm.
every common case is still need hospitalized, no matter he has symptoms or asymptomatic.
Mhm. How about the insurance system? Is the insurance system okay for COVID-19? It's the government is paying for COVID-19.
Government paying this.
Yes.
Government paying
Okay.
this due to it is a contagious disease. So
Okay.
the government will pay for the bill.
Okay. Terry, thank you very much. 感谢您的帮助. Okay, so thank you very much, Dr. Hu, and we'll now proceed to our next speaker. And then, Dr. Barcelon, can you introduce our next speaker for now? So we are able to have the general overview of our guidelines and the situation. So I think our next speaker will be able to expound more on the current situation and the other implications of COVID-19 management in Taiwan.
Thank you. Thank you again, Dr. Hu, for your very informative lecture. And we learned a lot of things, especially about uh, community surveillance and contact tracing and the criteria. So now I am truly honored to introduce our dear classmate and fellow alumna from the UP College of Medicine, Dr. K.M. Kua. She had her pediatric residency training at the Georgetown University and her neonatology fellowship at the prestigious Johns Hopkins University. We're so proud of our dear classmate who was also selected as as an outstanding physician for Taipei in the year 2000. And in 2010, she was also selected among the top 100 physicians of Taiwan. So our classmate is now connected also with the Cathay General Hospital. And we would like to welcome Dr. K.M. Kua. Thank you very much again for accepting our invitation and joining us in this webinar. I'm sure you also have a lot of lessons for us based on your personal experience of the successful management of COVID-19 in Taiwan. So for now, let us welcome Dr. K.M. Kua. Thank you.
I would like to thank Len and the coalition for inviting me to share my observation and my experience with the COVID-19 in Taiwan. So I'm going to show my slides.又怎么就收 slides？ 回去这个。你先回去的桌面，怎么回去？你缩小一点，你点这里看看。为什么呢？你先讲一下，我帮你处理一下。后面显示，它有个显示。OK。然后slide。桌面我在桌面，我看一下。拉过去桌面。谢谢。没有了。缩小，要怎么缩小？那你这个缩小键，没有缩小键，奇怪。Share screen。你看到应该有开，你的那个呢？你的档案在桌面。你的桌面，我的桌面，你要怎么去你的桌面？就是不知道。没有，移开挪开，怎么挪？你刚才可以挪开。对。隐藏这个，桌面没有吧？你落下来，落下来。不然，你插我这里，好不好？我插我这里。
Okay, so we're having a few technical difficulties. So while we're fixing the presentation, again, so we'd like to thank our speakers. And as they've discussed earlier, so so far we've seen some of the responses that Taiwan has been doing, and it seems that it's very epidemiological. No? So a lot of the approaches for Taiwan has actually been, based on the evidence, has been based on previous experiences. No? So a lot of this some people actually attribute this to the fact that the vice president of Taiwan from 2016 to 2020, So in the earlier part of this year, before the new vice president was actually sworn in this June, um, previously from 2016 to 2020, the vice president of Taiwan is Chen Qianjian, who is actually an epidemiologist. Now, so the vice president of Taiwan from 2016 to 2020, Chen Qianjian is an epidemiologist who actually experienced SARS from 2003 to 2005, and he was actually the Minister of Health back then. So learning from SARS and learning from the response that they had to do, as well as MERS. No? Pero mostly, it's really about what they went through on SARS from 2003 to 2005, during the time that he served as the Minister of Health. Actually helped Taiwan formulate the responses and formulate a very epidemiological and evidence-based approach to solving COVID-19 using their government approaches. No? So that is something that is a big contribution to that. So okay, so I think we're ready. Dr. KM, I think, is ready to present her presentation. Okay. Try Michelle. Well, we can't hear you. Okay, so we are preparing our audio. There.
Can you hear me?
Yes, yes. Okay.
Can you hear me?
There. Okay.
没有，奇怪了，怎么会这样？
那你用我的好了。
用你。
Josh, can you hear me?
Josh, can you hear me?
我会听。
Can you hear me?
Yes, we can hear you.
Okay, I'm going to start again. Well, Taiwan is only 81 miles away from mainland China, and aside from that, there are around 850,000 Taiwanese residing in Taiwan, and more than 400 citizens working in China, and there are 2.71 million Chinese nationals travel to Taiwan in 2019. This is the map showing that Taiwan is only 81 miles away from China. So in January 25, Johns Hopkins University, where I was trained as a immunologist, predicted that Taiwan would be the second hardest hit country. But Taiwan has only 447 cases as of June 29 yesterday, and only 7 deaths. And there were 356 imported cases, make it 79.64%, and 55, 12.3% locally acquired. And there are also 36 Navy crew that are infected too. And so I'm so glad that Johns Hopkins University make the wrong prediction. And how come Taiwan was so successful in responding to COVID-19? There are few factors that I can think of, and from my observation, because they have early preparations, deployment and prevention. They have rapid responses, prudent actions. They use high technology, the digital system, to fight against COVID. And of course, they have the cooperation of the citizen and private sectors. For early preparation, Taiwan has a very bad experience from SARS in the year 2003. This was a very hard and painful experience because there were 664 probable cases and almost 180 deaths, making it a mortality rate of 27.11%. So Taiwan did not just let go this hard experience and did not learn any lesson for that. They set up immediately a central epidemiology command center by the health ministry. And I'm going to talk about that later. So this early preparation was commanded by Dr. Ellen McKenzie, the Dean of the School of Public Health from Johns Hopkins. And I quote, Taiwan applied the lesson they learned from SARS outbreak to tackle the unique challenges of today's COVID-19. It's a model for other countries. One of the early preparations from Taiwan's health system is we have 25 years of national healthcare system. And this national healthcare system policy started in March 1995. 99.9% of the citizens enrolled health insurance. And this everybody has an insurance card. And this card contains big data information, such name, birthday, blood type, medical information, pharma cloud, organ donations. Another early preparation is placing the right experts at the right government position at the right time. Our Vice President, Dr. Chen Jianren, who has a PhD degree in public health and epidemiology from Johns Hopkins University Hospital. He was a Minister of Health during the SARS outbreak, and he is the Vice President. So he is involved in the planning and setting up the measures to fight against COVID-19. Dr. Chen Jimai is a doctor of medicine. He also holds a degree of master's degree in public health. He's the vice premier during the COVID-19. Another person that we have to mention, Audrey Tang, a transgender. He holds a Minister of Digital Ministry without portfolio. He is a free software programmer, one of the top 10 Taiwanese computer personalities. He set up all the digital communications and mass map during this pandemic. And then the success factors in Taiwan's fighting against the COVID-19 is a rapid response and prudent action. And I think Dr. Michelle Hu mentioned a lot of it. I'm not going to mention it again. But the first case reported by Wuhan was in December 31. So Taiwan CDC sent immediately an email to WHO and China CDC, telling them this is not atypical pneumonia is a very serious. It's sudden, unusual, not incidental, and require immediate attention. And of course, because of the One China policy, WHO did not respond to this email. On the best December 31st, where everybody is celebrating the Chinese New Year's Eve, at the New Year's Eve, the government held an emergency cabinet meeting by the premier. So an immediate activation of the border control measures mentioned by Dr. Hu a while ago was done. And they also stepped up the testing of incoming traveler. All passengers from Wuhan were subjected to health screening before the plane. And at that time, Wuhan only reported 27 cases. And nobody noticed about these 27 cases. But the Taiwanese was alerted. Another rapid response is strengthening the suspected case report from hospitals and from clinics. And of course, the level 1 travel notice for Wuhan. And Taiwan also classified COVID-19 as class 5 infectious disease. This means that all physicians, all hospitals and clinics should report this case to CDC within 24 hours. And of course, just mentioned a while ago that January 22, they activated the Central Epidemic Command Center. And I will mention their function later on. And the day after the activation of this CECC, the first case of COVID-19 was reported in Taiwan, and followed by travel notice level 3 to all countries. And 3 days before the Chinese New Year, the Chinese New Year is January 25. There's an emergency meeting of the Taiwan National Security Council by the president. And this CECC coordinate all the different government organizations. They coordinate all the pandemic responses. They update, pay public on the different policy measures. Other functions of the CECC is border control, case identification, fighting the misinformation, providing financial relief, resource allocation, implementing quarantine, health education, communication with public, hold daily conference to update the public on the outbreak, and provide adequate PPE, accelerate testing and develop vaccine. Right now, Taiwan is coordinating with one of the American drug company, and they are developing a machine. And we heard that the vaccine will come out later part of this year, like December. Dr. Hu mentioned about the border control a while ago, so I'm not to emphasize it. But what's important is the immediate response, starting from prohibiting nationals from China, then from Hong Kong and from Macau. And they also prohibit other foreign flag cruises from docking the Taiwan harbor. On March 19, foreign nationals are prohibited from entry to Taiwan without a special permit. All inbound travelers are subjected to 14 home quarantine. And of course, a travel notice 3 for all countries. By March 24, no travel airway passenger can transit through Taiwan. The other factor that really makes Taiwan a very successful response is a thorough and very strict enforcement of quarantine. So all the inbound travelers were quarantined for 14 days. And also the close contacts with confirmed or suspected cases of COVID-19 were quarantined. There are some ways to quarantine these travelers. They can have hotel booking or home quarantine, and they will have a health check before the plane. Home quarantine notice are sent to mobile phones of these travelers. Fever screening and symptoms were checked at the airport. Taiwan used a lot of digital fence in tracing and tracking. Taiwan had a department of cybersecurity that worked with the telecom carriers to track locations for those travelers. And this company developed an electronic disease platform in February. So all the cell phone numbers from this quarantine person are sent to one of the 5 telecom companies. And those patients or those quarantine persons without GPS enabled cell phone will be given one. Well, that's something. Given a cell phone, just to be quarantined. Now, if a person under quarantine leaves his home, alarm is triggered on the cell phone and sent to the local police, health and civil affairs agencies. And this alert the local police to come to your house and knock on the door or ring your bell. Authority also call the individual 2 times a day to ensure that person stays at home and did not leave their home without a cell phone. Now, Dr. Hu mentioned contact tracing a while ago. Taiwan has a very good contact tracing. We use manned forces, more than 3,000 personnel and digital system. We also use back tracing for 113 patients. This was occurred during early pandemic, that all the patients who were hospitalized who has negative influenza were retested for COVID-19. And among these patients, they are 113. And only one patient turned out to be positive. And this is a 61-year-old private driver for hire. His symptoms started January 27th, admitted to the hospital on February 3rd, and died on February 15th. And this is Taiwan's first mortality. So how do they trace this patient? He never went abroad. He's working as a driver, and he transports customers from the airport. So for this kind of tracing contact, it's a race against time. Every minute spent in finding the source of infection could mean another person could come into contact with this spreader and become infected. So the CDC analyzed the driver's cell phone correspondence of passenger he transported, cross-matched with immigration agency's database, and find out the travel from those from high-risk regions. And then they used the National Health Insurance Administration database to find out if they were treated in any clinic or any hospital. With this matching and finding, it narrowed down to 3 persons. So the CECC called and tested these 3 persons. One of them went back to China. So CECC used all the resources to draw blood from this 3rd person. And it was positive for COVID-19 antibody. So he was confirmed as a source of infection. Now, with this positive test, the CECC tested all the contacts of this spreader. His father, his brother, and a 9-year-old nephew were positive too for COVID-19. And this shows how the CECC has a tracing on all the contacts. They took pain, and of course, they spent a lot of money in tracing. This is the standard operating procedure at the international airport in Taiwan. The picture, the photo on the left, shows a health declaration, a travel history, and confirmation of your cell phone numbers. What they did is they called you with that cell phone number to verify whether you're giving the right number and to confirm whether the phone is working. And then they go through the fever screening center. Then if there's a fever, they will ask for your respiratory tract infection and any symptoms within 14 days. Then if they are positive, then you are sent to an outdoor testing center where testing was done. And the whole process took about 40 minutes to 1 hour. Now this picture showed how the airplane personnel, how they boarded the luggages and how they sanitize the luggages. This is another picture of how they do the sanitizing. This picture shows the cooperation from the common people. The picture on the left is a student coming from United States, June, early to middle March. And she wore, look at her. She had this PPE, the isolation gown, the goggle, the mask, the gloves, and even the shoes cover. So she's fully protected. She wore the whole thing during the boarding. And then she wore the whole thing on the plane. And the picture on the right is also a student. She did not have the isolation gown, but she wore a raincoat, a transparent raincoat. She had a goggle. She had facial mask. She also had gloves. And this is a driver or a family member who's planning to pick up a family member from the airport, and he cleaned the car before picking up. So I was told that you have to clean before and after picking up travelers from the airport. For this photo, it shows a traveler, inbound traveler, who has no PPE except an N95 mask. So the one who picked him up from the airport sprayed alcohol on his body and on his outfit just to be sure that he did not transmit the virus to other person. And this photo is showing a father who picked up his daughter from United States from the plane, and he sanitized again the luggage. Then before putting it into the car, and you see a partition, a plastic partition between the driver's seat and the back seat, and just to avoid the contamination and the spread of the virus. Okay. All the inbound travelers who are symptomatic were sent to hospital with an ambulance or special transportation. And the fee are shouldered by the government. Or if you have the national insurance card, all the expenses are shouldered. Then all the symptomatic patients will stay travelers will stay in a negative pressure isolation room in the hospital while waiting for the result of the COVID-19 testing. And some testing are done on the highest suspect at the airport. All you have to do is wait for 40 minutes and they have the test result right away. And you either send home as a home quarantine, or you send to the hospital and stay in the isolation room. So just as I mentioned before, two kinds of quarantine people, asymptomatic and symptomatic. Asymptomatic would be sent home or hotel. You can book a hotel and government will subsidize the fee. Symptomatic is hospitalized in negative pressure isolation. For quarantine person who's a job or for close contact of those confirmed cases, will receive $18 of 14,000 in 2 weeks, equivalent to US dollar $471. A patient told me that he earned money by being quarantined. Local civil officers also actively monitor the quarantine travelers 1 to 2 times per day. And they also provide cares and support services to the people. They help deliver milk. They gave you water, masks, tissue paper, garbage connection. So these garbage were connected by the Ministry of Ecology to avoid contamination. And these waste are regarded as medical hazardous waste. If they call them up, they will come to your house and pick it up. This is a quarantine home pack from different cities and municipality. And this is from Taoyuan. You can see they are crackers. They have masks. They have instructions. They have water. And they have chicharias. Again, from Hualien, they have garbage pack, masks again, rice, noodles, And this is from New Taipei. More mass, oatmeal, rice, noodles, packed noodles. So the government are very good to the citizens. Another Taiwan digital response offense to COVID-19 is the Pharma Cloud. The Ministry of Health developed a Pharma Cloud system in 2013. They store all the medical records and medication in this national insurance card where everybody has it. 99% of the citizens has this card. So the cloud computing system were used to conduct mass rationing. They use name-based rationing system. Residents who have insurance card can pre-order the mask on the line by the card and collect them at the convenience store or buy them at the drugstore. And the mask is only $5, which is 60 cents US dollars. All adult residents are able to purchase 9 masks in 2 weeks. Children will be able to buy 10 masks in 2 weeks at certain drugstores, pharmacies, or you can use the insurance card to pre-order it. And this card will tell you when the last time the patient has bought the mask. So if you go to drugstore earlier than 2 weeks, and the pharmacist will tell you it's not the time because the card told you so. The Ministry of Digital System, handled by Audrey Tan, developed a real-time map of mass for the availability information. One could connect to the link with the Ministry of Health and download this map. And this is one of them that I downloaded. The green dot means the location of the drugstore. And if this zoom in, you can see this is my clinic, and this is a drugstore nearby my house. And if you key in the drugstore, it tells you the name, the address, the opening time, the time of distributing the mask, and what time they close. Then you zoom in, you can have the store. Now, with this massive use of the national insurance card, engineering added 20 savers to the network to handle the additional load during the peak sale of the mask. And so to ensure the mask sale system could not compromise the main function of the card, allowed the healthcare system, including all the physicians, all the hospital and clinic, can have a smooth access to the medical record of our patient. Taiwan also use digital system for public education. The government developed a website with government community for information on the mask, travel information, explanation of COVID-19 cases, and diseases-related statistics, and government announcement, and also academic papers. All the above information or the link are sent to residents' cell phone, so you can view it at any time in your cell phone. And this is one of them. This is one of the English one that says that stay home. Otherwise, you will have a penalty of 1 million. Were there any person who will find yes? There are some people who did not follow the stay home regulation and will fine 1 million. And this is a post that shows that don't throw your mask away. And if you throw your mask on the ground, there will be a fine of 3,600 to 6,000. And the CECC used this nice, cute doggy with with the eyeglass. And his name is CEO, Chief Executive Personnel. Another public education is asking the citizen to wash their hands. And if you did not wash your hand, don't touch your mouth, your eyes, and your nose. Now, you cannot do it, you have to wash your hand first. And CEO, the doggy, tells you that you have to have a social distancing of 1.5 indoor and 1 meter outdoor, and wash your hand all the time. This is a QR code that you can scan, and you can have all these COVID-19 teachings, all the pandemic from other countries, quarantine instructions. This is a press conference, Health Daily, by the Department of Health. And the gentleman at the middle is the Minister of the Department of Health, or Ministry of Health. And this is the 100th day they held the press conference. The CECC used a lot of digital response to identify the case and to protect medical workers. And I feel so safe working here as a private practitioner and a private pediatrician because I was protected. I was given 160 surgical masks in 2 weeks, 9 N95. I also was given isolation gowns, facial shield, goggles for my practice. So aside from this, the CECC integrate the health immigration database to track the travelers. And this is tracing. CEC also integrate the travel history data from the national immigration with the Pharma Cloud system in the national insurance card I mentioned a while ago, to allow a doctor like you to have access to travel history of your patient. So when a patient travel, if you have his travel history, it helps the physician to determine if the patient with URI symptoms should be tested for coronavirus. The database integration also enables back tracing of patient record and travel history for retrospective testing. And this is the scanner from my clinic. I just connect it to my computer and I put my physician's card on the top and the patient's insurance card at the bottom. And then I can scan the travel history. And the screen will tell me whether in 30 days, where they come from. Now, even the country they transited will be shown in the screen. So I feel so safe in practicing in Taiwan. There are some private concern that this travel history availability in the computer invade the privacy of the citizen. Now, according to CECC, the patient required to inform the doctor in the history taking about the travel history anyway, even without the data integration. And the data integration is a measure to protect all the doctors, all the nurses, against patients who lied to you, who lied about the travel history. And they put the doctors and the nurses into a risk of infecting from the COVID-19. Now, if the doctors is infected or saw a patient with a positive case, the doctor will be quarantined for 2 weeks. There's also privacy concern about the GPS tracking used by the government, and they have the access to the user's data. But the Taiwan has a law, it's called the Community Disease Control Act, and Special Act on the COVID-19 Prevention, Relief, and Restoration. This prevention and this law give the CECC authorization to enforce disease prevention. They give them the authority to access to the user's data. Another success history is because Taiwan's citizens are very cooperative. So we have cooperation of the citizen and from the private sectors. The government controls the mass production, distribution, and the price of the mask. as Dr. Hu mentioned ago, that mask is really important in prevention of COVID-19. In February, during the early stage of the pandemic, Taiwan can produce only 1.8 million masks per day. So the government looked for businessmen, look for factories who can produce masks. And then they found out that there's a businessman, Mr. Lai, who answered to the call, and he called on his colleagues, more than 100 private engineers from the mass production company. They assembled 60 production machines in 23 days. And that's a record breaking. To produce 60 production machines, to assemble it, it takes about 4 to 6 months. And this guy, with the 100 engineers, were able to produce the machine in 23 days. And now, so Taiwan can produce 17 million of masks per day. As Dr. Hu mentioned a while ago, that it's very crucial that all citizens should have a face mask. So the Taiwan doesn't only took over the production, the rationing, distribution, they also determine the price so that every citizen can afford buying the mask. Only $5.60 US equivalent. So they also prohibit mask export to other countries from January to June. By this time, we are free to buy masks and export it to our friends or family in Philippines. Because of this mass production of masks, Taiwan was able to donate face masks to other countries and allies. And they were able to donate 60 million of masks to countries, to allied countries. And fortunately, Philippines received 300,000 masks 2 months ago from Taiwan. This is a picture showing that factory that assembled the machine, the mass production machine. And this is a photo showing the mass production and factories where workers wear isolation gowns, masks, and cups in the assemble of the mask. Well, aside from those factors, the measures and the policy from the government, the response of the citizen also account for the success of Taiwanese response to COVID-19. The people strictly follow the social distancing. They wear masks all the time. They wash their hands with water and soap and also with alcohol. They avoid big crowd gathering. And they all responsive to government's regulation. And this is a photo showing cleansing of hands before going to school and buildings, social distancing of 1 meter indoor, and 1.5 meter social distancing outdoor. And this is a reporter from the television interviewing common people. And aside from wearing the mask, it's 1 meter apart. This is subway showing that most people wear masks. I cannot find anyone who does not wear masks. I like this. We do not have lockdown here in Taiwan, so everybody can go to the restaurant. The restaurant put up transparent partition at the middle of the table, so people will be isolated while they're eating. You cannot wear masks during eating, right? So they put partition between customers. This is the one that I like most. These are the school children. They wear the mask, but they have this yellow partition. And guess what? This yellow partition is used during lunchtime. They took off their mask, they eat their lunch, with that partition. And this school not only has the yellow partition, they wear head cap. This is the minister of the Ministry of Health from Taiwan. And this photo shows how to wash hands with soap and water. Okay, so as a summary, the reason for success response from Taiwan is early preparation, deployment and prevention, rapid responses, prudent action, use of high technology, digital system, and cooperation from citizen and private sectors. Aside from that, I think transparency, transparent information, honesty also contribute to the success of the response. Obedient citizen and nationwide cooperation is also important. As an ending, I'd like to share 2 Bible verses from the 2 Chronicle chapter 7, verse 13 to 14. The Lord says, when I shut up the heavens so that there's no rain, or command locusts to devour the land, or send a plague among my people, if my people who are called by my name will humble themselves and pray and seek my face and turn from their wicked ways, and I will hear from heaven and will forgive their sins and will heal their land. So let us pray every day with these verses that we should humble ourselves. We should pray to the Lord all the time, seek his face, turn from our wicked ways, so God will heal us from heaven and will heal our land. So lastly, this photo says Taiwan can help. And thank you for listening.
Okay. Thank you very much to Dr. Kaangkwa for the sharing. So I just want to ask before we proceed, Dr. Ko, that you mentioned earlier a lot of the responses that Taiwan has been doing is really about what we have learned from SARS and how our government has actually responded to healthcare of the people. Would you comment on anything regarding the World Health Organization of how Taiwan was able to not rely on the World Health Organization, but rather...
Say that again, please, because I have some problem with my earphone.
Oh,
Repeat
sorry.
your question, please.
Oh, okay. With regards to Taiwan's experience, especially since they are outside the World Health Organization, are there any benefits that Taiwan had because they are not part of the WHO in being able to do proper responses?
Say it again.
Sorry. Okay. Since Taiwan is not a member of the WHO, is it actually beneficial because Taiwan was able to respond on its own terms rather than relying on what the WHO advised? Oh, sorry. Oh, okay. Okay. Sorry. Can you hear me now, Doc? Can you hear me now? Hello? 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 Okay, I think there's a problem with the sound.
Can you hear me?
Yes, I can hear you. Yes, I can hear you.
Cannot hear you.
Oh, can you hear me? No?
Okay, okay. It's
Can you hear
okay.
me?
Yeah,
Okay.
sure.
I just wanted to ask before we proceed to our questions. You mentioned earlier a lot of the responses that Taiwan was able to do on its own, learning from its own experiences. Do you think it contributed because Taiwan is not a member of the WHO, that Taiwan was able to do its own evidence-based knowledge instead of relying on what the advice WHO was giving?
the WHO rejected Taiwan as a member of the WHA and WHO because the one China policy. So we did not have any connection or any information from the WHO during the early part of the pandemic. And that really helps. That really helps. Because we have our own policy, we have our own measures. And I think it's a cooperation between the government and the citizen. It's a nationwide cooperation. So you're right. I think without the WHO help, we do a lot better.
Oh. What do you think about what do you think about those? Still, would you still prefer that Taiwan join the WHA and the WHO?
Of course. No man is an island. With another pandemic or another, really serious disease going on, we need other people, other country to help. And we are so lucky this time. They're so successful. Now, in fact, I calculated if United States used the same measures we did, there would be only 100 deaths. Only 100.
Okay, thank you for that. Though, okay, are we going to go ahead with a question for Dr. Kai? Okay. In the meantime, maybe I could ask another question. Yes. Doc, I've actually been dancing about the Yuan Jumin, the indigenous people of Taiwan, since I know that there are a lot of health inequities, especially with the indigenous people. Were there any concerns with COVID-19 reaching their communities?
I don't have the specific numbers, but they don't have much COVID-19 at that area, that Hualien area, the one that I showed the home pack a while ago. Now, most cases are concentrated in Taipei and New Taipei City. And because most of I would say 79% of our COVID cases are imported from the United States, from China, from Europe. And Hualien is more of a remote city. So they don't have the COVID-19 that much.
Okay. There's a question from Dr. Len Barcelan that she's asking, did Taiwan designate an exclusive hospital just for the COVID-19 patients?
Yes. Mm-hmm. Yes, so we do have. They designated, they have levels. They have hospital who can do the testing, and then can have a backup hospital where they have a lot of negative pressure isolation room. So they admit patients to those hospitals, and most of them are teaching hospital. And Cathay Hospital, the one that I'm affiliated and Dr. Hu is working, is the hospital where we can admit COVID-19 patients to isolation rooms.
Is there a difference between the public and the private hospitals in dealing with COVID-19?
No. They charge higher probably. But all the testing are shouldered by the government. And if you're hospitalized, only 10% of the hospital fee will be shouldered by the patient. The rest will be shouldered by the national insurance company. And that's why a while ago I mentioned that this national insurance card, is so important. It contains everything. You can use that to purchase your mask. You can use that to trace patient. You can use that to tracing those patients you thought that you missed in the diagnosis.
Okay. There's a question here from Giselle. Giselle is a masteral student from Japan. She just wants to ask, did Taiwan also respond to non-COVID-19 responses? How are you able to balance your response with regards to the essential services apart from the COVID-19 specific approaches? Was there a difficulty balancing the two kinds of care?
What do you mean by non-COVID-19 responses? That I really don't understand. That all we have is COVID-19 responses.
Mhm. I think what she's referring to are the essential services. Did the essential services stop during the COVID-19 approach? Those for nutrition, for preventive services, were they affected by diverting all the attention to COVID-19?
No, no, no. I don't think so. Now, only the high-ranking physicians are placed in the big-time hospital can take care of the COVID-19. And the rest of the physicians, like me, I'm still seeing patients every day. Those with diarrhea, with fever. Okay, so we don't just concentrate mainly on COVID-19. Only a few percentage of a physician is devoted to caring those patients. The rest are caring for the rest of the citizens.
Okay, thank you very much. Now, so another question. We have a YouTube comment from Mr. Rene de Grano. How, since you have lived in the Philippines, Doctor, and you know that the conditions in the Philippines, do you think what Taiwan has done will also work out in the Philippines?
I think so, Rene. He's my classmate. I think so. Some of it we can follow them, like tracing using man-force. If you don't have the insurance card, you don't have the digital system to trace them with the scanner, we can use man-forces. We have a lot of man-forces in Philippines, but you have to strict about it. Be very strict about it and really thorough in tracing the contacts.
Well, as you are aware, Doctor, our contact tracing has a little delay. Usually, it takes around 13 days before contacts are actually traced from the time that they test positive.
I mentioned a while ago, every minute lost in tracing is a risk of spreading to other people. And that's when the first mortality here in Taiwan was a lesson for everybody. We back trace the contact using the digital system and match with the immigration and the National Insurance Administration to be able to come up with 113 travelers. And it costs much again, then narrow down to 3 patients. So even though we don't have the computer system, but tracing is really important.
Yes, thank you very much. Another question from Dr. Okay, this one. May we know about the role of the community or public health centers at the periphery of the healthcare system? So those outside the hospitals, those maybe in the other counties. Were there any? How do they play a role, especially in the community? You mentioned the clinics, and then I think Dr. Hu also mentioned about the other community surveillance systems. So how do they play a role in the larger healthcare system for COVID-19 and in general?
Well, there are so different levels of healthcare in Taiwan. We have level 1, 2, 3, and so is at the healthcare center. We have local healthcare clinic. We have local health centers where people can go to, and if they have any question, they could call them up. In fact, there's a hotline of 1922 that everybody can call, and all the local municipalities, they have their own hotlines that you can call them all the time for any questions, or any public educations.
Mhm. Okay. There's another question. Okay, from Dr. Jojo Carabeo. Is there a role for traditional medicine in the COVID-19 response? Since we mentioned the pharmacological treatments, so what about the traditional medicine?
Well, since I am a doctor, I met a Chinese herbal medicine, but I heard people are doing that, but it's not the standard operative management.
But have there been any government approaches to dealing with traditional medicine in COVID-19?
No, I don't think so.
Okay. Okay, from another question from Dr. Sylvia De La Paz. So, did the PRC actually congratulate you, or was there any reaction from mainland China or the People's Republic of China, or did they ignore the successes of Taiwan?
It's a hard question to answer. Well, because of the one Chinese policy, mainland China also always considered Taiwan as part of China. So, of course, they denied the success of the response.
Mm-hmm.
Even all the country, including United States, Germany, England, Canada, all these countries, developing countries or developed countries, congratulate Taiwan for their success, but not China.
Mm-hmm.
By the way, I was born in China.
Oh, so gongsi to Taiwan still. So another question. What's the role of the insurance in responding to COVID-19, the pandemic in Taiwan? So we mentioned earlier how much people have to pay, and what is the role of it?
This national insurance policy started 25 years ago. 25 years ago. So a citizen pay a certain amount of money. The highest amount paid is like 6,000 to 7,000. Like a physician like me, I have to pay that much. But for non-workers or household members, then they pay like a few hundreds or 1,000 per month to be insured. And everything is paid, including the outpatient, the inpatient. Outpatient, you only pay a minimum fee for registration, $950. And then you pay 10% for hospital fees. So healthcare is really a very good system here in Taiwan. And that's one of the incentive that people try to immigrate to Taiwan and try to come back from the United States or from Europe to Taiwan because of this medical system. We pay less and yet we get the most healthcare.
Yeah, so it's important to note that the Taiwanese NHI is around the same age as the PhilHealth or the Philippine Health Insurance Corporation. But one thing that I think is important with Taiwan's health system is how much Taiwan spends for health. I remember reading that Taiwan spends around a lot, around 16 or 15% of the gross domestic product for health. And so the Philippines spends way less. But that's something that the National Health Insurance has been able to help. You mentioned earlier, Dr., that's around, you pay around 6,000 Taiwan
For a
dollars?
physician, the highest payment.
Right. That's around
6,000 to 7,000. That's about $200.
Yeah, that's around 10,000 pesos in the Philippines. So most citizens pay are at most 1,000 Taiwan dollars.
No,
so
about few hundred.
hundreds.
You're another worker, yeah.
Right. So it's really affordable for a lot of
Yes.
people. Yes. Okay. So are there any other questions? So yeah, the rest of the questions are thanking you, Doc, about the showing what is important with regards to healthcare in Taiwan, and it makes, I think, a lot of people depressed of the Philippine healthcare situation. So with that, though, before we end, do you have any closing remarks to how COVID-19 is being responded to in Taiwan, and what are any lessons you'd like to tell the Filipinos or the Philippines with regards to dealing with COVID-19?
I think it should be a nationwide cooperation. Not only a good policy or measures from the government, but it is a strict implementation of those measures and cooperation on the part of the citizen and the private sectors to be able to respond to this pandemic. And Philippines is the country I grew up. It's a country who trained me as a physician, also trained me as a pediatrician. So I would pray that 2 Chronicles chapter 7, that if we humble ourselves, we turn back to God, then God will heal the land.
Okay, thank you very much, Dr. Kua and Dr. Hu. We know you're busy. Wajita Ninhan Mang. Soy woman gansi at Swan Light. Jian. So thank you very much for your support. I know you're very busy and you have a lot of concerns and work that is being done in Taiwan, and the Philippines has a lot more work to do with regards to COVID-19. So thank you very much again to both of you for sharing your insights and your experiences in Taiwan.
Thank you.
Okay. All right. So we are ending our webinar for today, which is really we've really learned, so how Taiwan was able to its beat COVID-19 or in with regards to their local society. But in the Philippines, we have a long way to go. We're still at 36,000, and we need more. There's still a lot of cases going up in the Philippines, while in Taiwan they've contained it. They've managed to quarantine all the active cases, as well as the contacts. So why, again, the question is raised, why did Taiwan not do mass testing? And it's really about being able to control all the other aspects. So we don't have to do mass testing if we're sure that where our cases are. So at the end of the day, in the Philippines, since we have community transmission, which means hindi na natin alam kung asan yung mga cases natin. Hindi na natin alam what specific areas, no? Kasi, we've lost the time. We were in ECQ from March to May, but we've lost, even if we claim that the ECQ should have bought time for us, mukhang hindi, no? Kasi marami pa rin yung mga kaso at dumadami pa yung mga kaso. So because of that, because we were unable to initially track all the cases of COVID-19 that was in our country, now we have to do mass testing to find out where they are. And then do what Taiwan has been doing, proper quarantine, proper contact tracing, and really a better health system. Now, they mentioned earlier that they did not segregate the care of COVID-19 patients from non-COVID-19 cases. Though there were specific hospitals, the doctors still continued to function with their normal roles in prevention and proper primary health care that is needed by the people. So it's really about strengthening our health system, strengthening our health, the level of our healthcare system, the quality of our healthcare system, and basically the direction that our nation is taking with regards to its leadership and the cooperation of the people. So it's really that, no, that shows the strength of Taiwan and what is needed talaga in our country is so much more than just the testing, so much more than just the tracing, but really a proper direction and proper planning that involves everyone in our country, not just the leaders, not just the doctors, not just the police or the military, but the entire society that is doing their job. Similar to our previously hosted webinar with Vietnam and Cuba, it's basically about mobilizing the people and ensuring that they have a right to healthcare. So that's really, at the end of the day, that is what the Coalition for People's Right to Health is calling for in raising the bar. So again, we go back to that graph that we kept showing in our previous webinars, that we need to raise the bar in what has to be done in our communities, in what has to be done in our workplaces. And at the end of the day, it's really about improving our healthcare system to ensure that our people have the right to health and a better standard of living, not just during a pandemic, but even afterwards. So again, we thank our speakers, Dr. Hu and Dr. Kuo, for sharing their experiences in Taiwan, and hopefully we can learn from that and demand what is needed in our country, demand what should be done. But we cannot just copy. We cannot just copy and paste the strategies. But at the end of the day, it's really about making sure that our healthcare system is responsive to the needs of the people and the needs of and the right to health of every individual. So it's not just about these things. It's not just about the bar. It's not just about the curve. But at the end of the day, it's about improving that healthcare support to hospitals, testing, the health workers, and our primary healthcare system in the schools, the workplaces, and the real front lines of COVID-19. So with that, thank you very much to everyone for joining our webinar today, Raise the Bar, the Raise the Bar series, which is Zero, How Taiwan is Beating COVID-19 for its people. Yes, to everyone, and hopefully we can all stay healthy and continue the good fight in realizing the people's right to health. Thank you very much.